Hi, I'm Dr. David Haase with the MaxWell Clinic, and one of the most profound experiences of my life was the white coat ceremony at Vanderbilt Medical School. It was my first real day of medical school, and Dr. Dean German, a real hero of mine, stood at the front of the room and she asked this question: what is the good doctor? And all of us, kids that were entering into medical school, we started spouting off things like, well, intelligent and kind and hardworking and knowledgeable and blah, blah, blah. And pretty soon she had a whole blackboard filled with descriptors. And when we looked up at that blackboard, we were just overwhelmed with, wow, that's a huge list of things to live up to. And what I came away from that session was that for the rest of my life, I needed to be asking myself, what is the good doctor? How am I going to be the good doctor? And that transitioned into another question, which, what is good medicine? What is good medicine? There's all kinds of terms out there about medicine and the incredible striving of physicians to keep reinventing ourselves, which is awesome. We have allopathic medicine, we have osteopathic medicine, we have integrative medicine, functional medicine, holistic medicine, there's traditional Chinese medicine, Ayurvedic medicine, and all of these have a philosophy around them. And each one of them has a bias because it comes from a particular history. And I recognize that the brain is really at the centerpiece of all of our hopes and aspirations and capabilities, but our brain also always gives us a bias. We can only see the world through our particular eyes. And much of our medical world right now is what we would call linear. It's looking at everything as a cause and an effect. We do one thing, I'm going to diagnose this and I'm going to treat this. And unfortunately, our reality is a system. Everything is connected to everything else at some level. When you step back and you recognize this interconnectedness of human biology, human psychology, the environment in which we live, all of these things, you recognize that we are a system of systems that is inside a system of systems. Everything is connected to each other. And when we recognize that, we can start saying, well, wow, since everything is a system, how do we practice medicine? Medicine means that which creates health. So what we're seeking is a medicine that creates health for our system, our human system, the life experience that we have, of all of our organ systems as they work together, our social systems, our educational systems, the environment system that we find ourselves in. They all matter. Because there has been this divide and frankly a lack of clarity with regard to what is good medicine, we started this concept of MaxWell Systems Medicine. So MaxWell, shorthand, is for maximizing well-being. Systems, meaning that you, in the context of everything that you encounter, and medicine for the creation of health, is what we're endeavoring to, what we already do and what we are continually building on so that we can practice good medicine. It will contain parts of allopathic medicine, Ayurvedic medicine, traditional Chinese medicine, functional medicine, preventive medicine, integrative medicine, proactive care, reactive care. The real question is, what is the medicine you need now? What is your next best step? And how do you understand what your life journey is about? What are your health goals? And those health goals should direct the application of all of these different systems of thought, all of this different organization of information towards what is your ideal outcome. So MaxWell Systems Medicine is a way of thinking of that results are what matter, that you are a sacred being of infinite worth, and when you are encountering what we call healthcare, it should both be supportive of your health and be caring. And that is all of what's wrapped up in this concept of MaxWell Systems Medicine. How do we investigate you more fully? How do we develop a relationship and listen more deeply? And how do we prioritize a care plan that is in keeping with what your health goals are? It's as far as we can push personalized, preventive, salutogenic systems, relational medicine. And as opposed to using all those different terms, we're just seeking to practice good medicine that we call MaxWell Systems Medicine.